Tuesday, Tuesday. Tuesday, Tuesday.
Jude and I are gonna go grab a beer. You wanna join?
She's a lot cuter than either of you guys.
True enough.
Enjoying your victory, Dr. Hawkins?
Did you call immigration? You had your billing consultant do it for you.
Barb Olson's contract with this hospital has been suspended, but I have to pull $2 million out of thin air.
I understand.
No, you will understand full well when I take that money out of the internal medicine and ER budgets. Be prepared to be woefully understaffed for the next 12 months.
Did you call immigration? You had your billing consultant do it for you.
Barb Olson's contract with this hospital has been
Oh no, I don't have VIP.
$2 million out of thin air. No, you will understand full well when I take that money out of the internal medicine.
By the way, thank you for today. Thorpe could have had you canned on the spot.
Well, I get fired, it makes a decision for me, right? I show up tomorrow, Fort Benning, 6 a.m. Hell, you could be there with me.
Yeah.
All right, so you're starting to come around. What are you so damn happy about?
Because I know exactly where I'm supposed to be tomorrow, and it's at Chastain.
Yeah.
Valor, honor.
Victory. You there with me? I got these. All right, you start to come around. So you know, I've been meaning to ask you and Nick. That still a thing?
She doesn't think so, but I think she's worth fighting for, don't you?
Oh, hell yeah. Game on. So you know, I've been meaning to ask you and Nick. That still a thing?
She doesn't think so. Worth fighting for.
Oh, hell yeah.
Baby scar of us, beautiful scar of us. On my back and all, you see I fuck home. You gave me scar of us, beautiful
28-year-old female, cancer patient, short of breath, vomiting, he's dropping. Ultimately, we're saying why up and down.
Why I don't have VIP?
Previously on The Resident.
I had a question for you. Old friends develop a bit of a tremor. What about benzodiazepines?
Dr. Hunter, if there's ever an opportunity to help you with your research, count me in.
I saw Lily earlier. She didn't look good. They went to check Lily's files, and they were missing.
Dr. Hunter keeps her patients' records separate on her own server at her clinics, not at the hospital.
The operation came off without a hitch. You had a spectacular surgeon.
Jake, Louisa will be taken care of, but I have to pull $2 million out of thin air. Be prepared to be woefully understaffed for the next 12 months.
Dr. Hunter keeps her patients' records separate on her own server at her clinics, not at the hospital.
Hi. Patient in bed 6 was triaged as acute.
He said his pain was a 10.
Your pain is always rated the lowest priority, basic. Certainly not acute, which means big deal emergency. When is Nurse Hunley back?
Oh, she's at St. John's now. Budget cuts or something. I got your back.
bleeding, possible liver lack, and right-sided pneumothorax.
Acute?
Bus overturned on I-85. Multi-casualties. Ambulances are stacking up outside.
Hey, Dr. Hawkins, we need help down here.
Both acute, a trauma bay 2, and a bed 8.
Where is everyone?
Saw blowback from helping Louisa. Our budget was cut. ER staff nearly half midnight to noon shift.
Right, well, we have Claire to thank for that.
Nurse Hunley was let go. Too experienced, too good, too expensive. New triage nurse is a bubblehead.
All right, let's go.
Urgent. Look, I don't want to tell you to do your job, but she's awake and breathing.
Basic.
My hand hurts.
Hey, I need to see a doctor, I think. I wiped out on my skateboard, I wasn't wearing my helmet. My head hurts a little bit. A little road rash.
Okay, a headache, a road rash, still breathing. Basic. Please just take a seat in the waiting room. Basic, 3 to 8. Tachycardic, 168.
Charge. Clear. Shock. Still no pulse.
Air acts as an insulator. It prevents the shock from getting to the heart, which is the point of the defibrillation. So we remove it and we reapply directly to the skin. Charge. Clear. Shock. Sinus rhythm. Where's your ID bracelet?
Didn't get one. Think I can aspirin? Head's killing me.
Not until you see the doctor. I'll get you an ID.
No. Hey.
Lynn Carter? It's okay? Dislocate your shoulder. I've got it. Good news is we fixed it. Better?
Here you go.
Excuse me. This isn't mine.
Hey, Irving. Bed 7's an 8-bit with RVR. I'm giving 10 until ties in.
Whatever, man, just do it.
Excuse me, doctor.
Yes,
Excuse
we'll
me.
be right with you, man.
Doctor, please.
Sir. Hey, sir. Let's get this guy to acute now. Get his vitals, start an IV. Let's have the inpatient car standing by. He's unresponsive. Pulse.
Double access wide open fluids, peripheral neo for now. Dr. Okafor tubing.
On it.
Damn it. Left pupil is blown. Looks like we have a brain bleed. Do we have images?
There's no ID bracelet, so there's no way to know if they're tests.
Is he gonna be okay?
Where's this patient's ID bracelet? Has he even been checked in?
I didn't have time.
What's his name? Find his name.
Ian, his name is Ian Robinson.
Can you hear me?
Can't hear you. My best guess is a subdural hematoma.
The bleed must be compressing his brainstem.
Was there another way to relieve the pressure? Like burr holes.
Not without scans to know where the bleed is. They can't just blindly drill into the
But
brain.
he's gonna be okay, right? Because he said he just had a headache.
Where's this patient? Has he even been checked in?
Please. Please, no, he can't.
He has no ID bracelet. He didn't even admit it properly. So we have to learn his name in the middle of the code. Ian. His name is Ian.
I found him. Just lying over there, unattended, in basic.
Why didn't you triage Ian properly?
It's my first day. Please no.
He had a head injury. That's at minimum urgent,
We
always.
were so busy. And he seemed okay.
With brain bleeds, there aren't always symptoms at first.
He had a head injury. He should be on concussion protocol in urgent.
The patients, they kept coming. And I didn't want him to be marked as urgent if he was basic.
It's better to be overly cautious with a head injury. Now you know what happens when you aren't. Next time your patient won't end up like Ian, dying alone in basic.
All right, everyone, let's get back to work.
Someone is dead because of her mistake.
Yeah,
He had a head injury.
she'll always carry that with her.
He should be on concussion protocol.
He's right. We need to move on and focus on the patients that we can help.
And I didn't want him to be marked as urgent if he was
It's
basic.
better to be overly cautious with a head injury. Now you know what happens.
Bed too?
Next time your patient won't end
Oh,
up
you.
like Ian, dying.
All right,
Heart rate is 120, blood pressure is 110/60. That just means your body's working hard to fight off this infection.
Okay, well, Dr. Hunter just gave me a mega antibiotic, so it should start working soon.
I'm so sorry you're going through this, Lily. Your immune system was not strong enough the last time you left the hospital. We should have kept you longer.
No, it's not Dr. Hunter's fault. But she knows what she's doing.
Of course, Dr. Hunter has a great reputation.
Yeah, she's the best oncologist in Georgia.
Hey, how long have you had this rash?
Just since this morning. It really itches.
Because I remember you don't have any allergies to any medications, right?
Honestly, I can't remember. Sorry. Chemo's trashed my memory. But it should be in my chart, right?
Well, Dr. Hunter likes to keep your paperwork at her clinic, but let me see what I can do to get the information sent over to you, okay?
Okay.
All right, I'll be back.
Ian's father, Paul's here. We're gonna go talk to him. You need to learn how to do one of the hardest things we have to do as doctors. Let's go. Mr. Robinson, Dr. Conrad Hawkins. Your son Ian suffered a fall, and it led to a subdural hematoma, which is a vessel. Ian's father, Paul's here. Are you ready?
That's not Ian. That's not my boy.
How's your day going? Could use a do-over. Yeah. We took his picture. We'll ask everyone who comes in if they recognize him.
I'll circle back later in the day.
Let me know if you find anything.
I dropped off the John Doe report with risk management. Now what?
Go upstairs and see our patients. Triple check that anyone who was admitted from the ER was properly diagnosed and treated. Who knows what mistakes are coming our way? I'm counting on you.
Circle back later in the day.
What about you?
I'm staying here. I'll take over triage.
Dropped off the John Doe report with risk management.
Great. Show it to all the patients and everyone in the waiting area. Ask if anyone knows who he is. The only thing we know for sure is he isn't Ian Robinson. Has real Ian Robinson showed up yet?
No, Mr. Robinson isn't even sure that his son was on that bus. Right now, we have no idea how the backpack even got here.
Lily's rash is really bothering her.
It's probably a superficial phlebitis. Change her IV and give her 25 of diphenhydramine.
Of course. Also, would it be possible to get her complete chart sent over from your clinic?
What's wrong with her record here?
We weren't able to find it when she was admitted. It seems to have completely vanished from our system.
Odd.
And since Lily's multi-resistant infection is so difficult to treat, I figured you'd probably be more comfortable if we had her entire history here.
Change her IV and give her 25.
Of course. You're right. I'll have the clinic send it right online.
Great. Thank you.
So how long till Shirley passes the gallstone? We're trying to get out of town for vacation.
Well, it really depends on how many stones there are. Any decreased appetite or weight loss.
Shirley hasn't been eating much.
Have you lost any weight?
Not much, a pound.
More like 15.
Your husband is very attentive.
Oh, he worries. But he's not my husband.
Right.
He's my boyfriend.
We met 6 months ago at an aero modeling convention. We were both building exact replicas of the Wright brothers plane. Yeah, for us it was love at first, Wright flyer. Please, doctor,
okay.
please help her.
Okay. I'll increase your pain med dose and frequency. As long as you're here, we'll run a few more tests. I don't want Howie to worry.
Then you better get these gallstones out quick so we can go on our trip.
Deep breath.
Oh, hey, Dr. Pravesh, I want to touch base with you.
I hope I didn't alarm you by ordering more tests. It's probably just gallstones.
Good. See, we're on our way to Kitty Hawk, and I'm going to propose in a big romantic plane-themed gesture.
It's great.
See, when you get to 80 without a wife, you figure nobody could ever love you. And along comes my Shirley. She's my everything. And if I should propose early, you let me know. I'm a practical man, and I don't want to be morbid, but Kitty Hawk, we're old, so please take good care of her. You get to 80 without a wife.
Things seem less chaotic.
We made our way through the worst of it.
Any word on the identity of the John Doe we lost this morning?
Not yet.
This is a new patient of ours, Shirley Harris. Take a look at the ultrasound. The ER doc diagnosed gallstones. I'm afraid he missed a mass.
What does the blood work show?
Slight anemia, weight loss.
Let's get the U.S. to better characterize the mass and the CT for the surrounding areas. We'll hope for the best.
Let's hope.
Kelly,
The ER doc diagnosed.
what are you doing? Preparing for the dissection? You aren't doing the dissection, you're a resident. I do it for Dr. Bell. Well, he's not here. If I was a resident, they wouldn't let me tie a knot unsupervised. Give me the Kelly. Watch and learn. I have nothing to learn. You're barely halfway through training. There's plenty for you to learn. What are you doing? Preparing for the dissection? You aren't doing the dissection, you're a resident. I do it for Dr. Bell. He's not here.
Any action on this? How much are you gonna give me if I make the putt?
Huh. You haven't mentioned money since you got a case of the yips.
How much?
100.
Sure. Downhill, very slippery. About 5.
Easy money. You haven't even two-putted in 6 months.
1,000?
Fine. You miss. You donate $1,000 to my son's school fundraiser.
Wonderful for the kids. I missed the putt. $1,000 to your son's school. I sink it. $1,000 to me.
Damn it! Man.
Back. Missed the putt. $1,000 to your son's school. Sink it. $1,000.
She may
made me hold the retractors the entire time, like I was an intern.
Insanity.
20-something male, John Doe. Fracture left femur, bruises in the right chest, neck injury.
John Doe. I thought we had all the casualties from the bus accident.
He's the last one. Found him way off in some shrubs. He must have been thrown on impact.
Okay, this could be our guy, Ian Robbins.
Taking to trauma 2?
Let's hope it's him. It'd be nice to tell Paul we found his son alive.
Really?
Setting.
Tenny, get a glide scope.
Airway.
Oh, no, that's surgery. You can't do that in the ER, not without attending supervision.
By the time someone gets here, he'll be brain dead. Get the trait kit.
You sure?
There's no choice.
There is a choice. You could choose to follow protocol.
The patient would die.
I'm not telling that father his son is dead for a second time today.
Don't do this. Tenny, get a glide scope. Stop!
That's normal.
Oh, no, that's surgery. You can't do that in the ER, not without attending supervision.
By the time someone gets here, he'll take this photo up to Paul Robinson and confirm he's his son.
Not to point out the obvious here, but you are a badass.
Let me see this badass's work. Surgery performed in the ER by an arrogant, overconfident, unsupervised resident. Flawless technique. You know how to cut, but you don't know when not to. I'm benching you for the day, clear? Get him up to my OR.
That's unfair. You saved the patient's life. Why don't you say something?
I want to cut tomorrow.
To the ER by an arrogant, confident,
Yeah, we'll work on both of those. My office sent over Lily's file. Did you get it?
Not yet.
Are you sure? Did you check?
Did they email it?
We don't email patient files. They're not secured.
Oh, let me check this next.
You saved the patient's life. Why don't you say something?
No fax.
Is the paper tray empty?
Nope, it's full. Just waiting for a fax.
Well, my office sent it over. The problem is in your end. It's a miracle people make it out of this place alive.
There's one person I wish wouldn't.
Sure? Did you check?
Did they email it?
Yes, that's my son. Thank you, Dr. Hawkins.
He's in surgery. You can see him just as soon as he's out.
Okay.
Any his medical history? Is he allergic to anything? Medications, food allergies? Any health conditions I should know about? Heart condition, diabetes?
Let's see, his doctor said that he has low calcium.
Tension on my carotid repair. Hold him still. Hold him still.
Baseline is hypocalcemic. The blood transfusion made it worse. He needs calcium.
Okay, well, add calcium to his IV.
What IV? It tore right out of his arm. We don't have access.
I'll put in a new IV.
Hold his arm. I'll rip his arm out of the socket.
The seizure won't stop until we get calcium into his veins. Well, we go, no matter what.
I need access now. There's too much
Almost
tension.
there. Almost
We're
there.
about to have a blowout on our hands.
I'm in.
Pushing calcium now.
Thank you.
It's gonna help with the breathing, okay? Page Dr. Hawkins.
I already paged her.
Give me the epi.
Nurses can't administer meds without orders.
Looks like they can. Where have you been?
Stuffy room with stuffier administrators trying to get them to rehire Nurse Hunley. Once I pointed out they could be looking at a lawsuit, they caved. She'll be back in the ER within the hour. She's wheezing. What's hanging?
Saline and imipenem. I just gave her epi.
Stop the imipenem. Hope it's the saline wine. Lily, you're gonna be all right. I'm gonna sedate you and put in a breathing tube to keep your airway open. I'm here, Lily, and I'm gonna take care of this. figure out which one of her meds is causing the reaction. There's so many.
I don't remember her having any sensitivity, so whatever it is.
Uy, nakabalik ka na pa kaloko.
The only new med is the imipenem.
Oh,
Is
no,
that or screwed?
13.
Is she allergic to any other antibiotics? Wait, hold on.
Bilis
The
lang.
chart only goes back as far as this current admission.
I know, and I've been trying to get it sent over from Dr. Hunter's clinic since this morning. They keep insisting they sent it, but never arrived.
With Lily's infection, I don't want to keep her off the broad-spectrum antibiotic for long. We need her charts.
May mic ba ako?
Hey, Debbie, can you cover for me for an hour?
Diyan ka pa?
Where are you going?
Lane's clinic. We obviously can't trust them to get us our charts, so I'm gonna go get it myself.
Late lang yung mga My Day sa sobrang dami ng picture. Hindi ko may My Day
It's
lahat.
early stage and confined in the gallbladder.
So there is a real chance the treatment can be curative.
Well, we can certainly reduce the chance of recurrence.
The tumor's located in the neck of the gallbladder. In order to get clean margins, some of the liver will have to be removed as well.
It is tricky.
Tricky. It's a minefield of blood vessels and bile ducts, and she's anemic. Clip the wrong vessel, once the bleeding starts, we might not be able to stop it.
At her advanced stage, there's a real chance she won't make it through surgery. Why risk it? I highly recommend a palliative consult.
Shirley's 80 is a young 80. More like 60, full of life. Her boyfriend's about to propose to her. She's a lot to live for.
If she makes it off the table.
It has been done successfully before.
Cancer. Gallbladder cancer.
Yes. But because we caught it early, there's a real chance for a total cure with surgery and radiation.
That sounds simple, but I'm guessing maybe it isn't.
More like 60,
Surgery
full
itself
of life.
is
Her boyfriend's about to propose to her.
How complicated? Could the surgery kill Shirley?
This is a highly aggressive cancer. Without the surgery, you could have less than a year. But with the surgery, you can have many more years.
Are you okay?
Kamusta si Boss David?
Say something.
I might be dying. And there's only one
Oh,
person.
boss.
I'm guessing maybe it isn't.
No comment na lang.
How complicated?
Kailangan ko ng
Will you marry me?
Magreklamo
You're not
ako,
supposed
mawala
to
pa
ask
ako
me
ng
that,
account.
Shirley Harris. I'm going to ask you.
Answer me.
Yes. I will marry you. Only if you marry me.
Yes, I will marry you.
Tama ba ako? Tama ako.
So, how do we make sure this life-saving surgery doesn't kill me? Because I got a wedding to go to.
In the hands of a lesser surgeon, I wouldn't be as confident, but you're getting the best. Dr. Randolph Bell has the highest success rate.
The man in the building.
Yes, he's our chief of surgery.
Are you sure Dr. Bell's right for this case?
He's done hepatobiliary surgeries many times. There's no one else here who can touch
For
his body.
excessing na bawas.
It's the record I'm worried about. His complication rates have risen dramatically lately, and I only bring this up because I know attendings aren't always aware of the problem.
Every doctor makes mistakes.
Of course, but this is far beyond.
Conrad, hold on. I'm going to speak to you now as a dear friend and mentor. You're one of the most gifted young residents I know. Don't sabotage a career that's just beginning. Doctors must support each other through good times and bad. You of all people should know that.
I'm grateful for all you did for me in the past, but I have to speak for my patient.
Shirley's my patient now. She wants Belle, who's my choice.
This is far beyond.
Let's all get on the same page with this decision. Shall we?
Wait nga muna yun.
Excellent.
Nasa pa ako punta. Yung sa'yo, nagdagdagan na bawas.
What would it take to get you unbenched?
The inflammation makes it hard to get a good view of the anatomy.
If I were assisting, I could clear the field for you to do that.
Yung sa'yo, nagdagdagan na bawas.
Kay's benched you.
You're the chief of surgery. You can unbench me.
I could.
It's a difficult surgery.
What exactly are you implying?
I'm saying your success rate is better when I'm
Bawal naman ako
beside
sa
you.
magagawa.
I agree with Dr. Kay's assessment.
transfer. Grabe, times 3 yung ano. Hindi yun.
You're back! You're back!
As much as I love to see a man on his knees, get up, Dr. Feldman.
Sayang naman. 33 lang yung minting mo. Floor price ng isang araw, nag-night.
Allie?
Kaya palang pa.
Nick? I haven't seen you since nursing school.
Type ka mo, hindi maganda. Wala pa nga.
Oh, no, no.
20 lang yung minting fee nung ano. Look, diba? Try natin. Maganda talaga, kahit na. Kahit na.
Can I help you?
Oh, I was just admiring the facility and that treatment room. It's incredible. You treat so many patients at the same time.
Tsaka
Dr.
ano
Hunt
kaya
doesn't want
tayo
to turn
no?
patients away, so we squeeze in as many as possible.
Payment lang.
Here's the file.
Watch token.
Just make sure it's
Yung mga atin.
Oh, thank you.
Excuse me, Dr. Hunter.
Dr. Prakash?
I wrote a paper on intraoperative radiation therapy, so I would love to observe this afternoon.
Well, you're certainly welcome to observe if there is a procedure. Medicare hasn't said that.
Let me take that off your plate.
Industrious, I like that. Be warned, Medicare doesn't like to approve expensive experimental procedures.
Oh, no worries. I can be very persuasive. Please don't hang up. Or believe it. I'm a physician calling on behalf of Shirley Harris. Shirley Harris. H.A. I cannot hold that, okay? Don't you dare. I need approval on an experimental. Yes, No, I will not hold. I have been hung up on 7 times and on hold for over an hour and 20 minutes. No code because it is a new procedure. Without tumor resection, the adjunct radiation procedure, the patient will die. Can you hold on a minute? We will. So relieved.
Binuksan na kami.
Where are you going?
Kitty Hawk.
You have surgery this afternoon. I just got it authorized. It took 4 hours.
Sorry. Can't make it.
Hold on a minute.
I'll be standing at the birthplace of aviation, marrying the love of my life.
After our honeymoon, we'll come back and fight the cancer together.
Right now, there is a window of time
Congrats,
where the
pal.
cancer is contained and we can remove it all. If we wait, the disease will spread.
Dr. Prakash, you don't know that the cancer will spread, or if the surgery will kill me. But I know that when I die, I will be this man's wife. We're going to kill him.
Wait, please. What if you could get married and have the surgery today?
I want to be married to Kitty Hawk.
Then I'll bring Kitty Hawk to you.
How'd you screw a lot of airplanes?
Howie has hundreds of them.
Hindi na ako nabigyan niya. Hindi na kasi ako masyadong nag-ano. Ngayon na ako ulit nagbabalik sa pag-stream.
proving his license.
Akala ko magdudemand pag gano'n, nakabalik na talaga.
And willing to write a wedding ceremony filled with airplane funds.
Kabalik ko lang din isang araw sa accent.
Photography? Publicist. Not all those a PR move.
A hospital story with a happy ending.
Meron niya sigurado. Pag nakita na lang nagbababag
Mars
sa
Bell was a
ano,
killer on
wala
the
na
mark.
magbenta. Baka meron pa nga magbenta dyan ng below minting price. Yung Canstar nga, kita mo. Medyo hype pa yun. Hindi siya pwede mag-request. Kaya lang, pag active kasi ako mag-stream, mag-post. Siyempre, ano ko yun. Hindi naman basta creator ka, bibigyan ka na ng kailangan active.
Right, let me know if anything
Ako nakabawi ng post sa Twitter.
Police are checking me.
You can only save the living.
Makikita naman nila kung sino yung mga active, yung mga bibigyan.
What is this?
Deserve naman yung mga binigyan.
Sort of life-saving playing card activity?
Gawin muna ka ng mga isang mo.
We should go now.
I'll take it from here.
Kaya nga, hindi ako nakagalaw ng Osimosis. Hindi, out of way kasi yung kasi hindi dun sa pinuntahan na.
I'm so happy you're my wife, Mrs. Green.
I'll get used to it.
Siguro sa
See you
susunod
when I
na
wake
punta
up,
dun.
Mr. Green.
She's in good hands.
Kusyol, meron ka ba niyan? Iba meron na yan ah. Takot lumabas dito. Total gastos? Naging magastos kasi kami kasi kain kami ng kain, pero kung yung laboy lang siguro ang isang tao siguro
Thank you, Jessica.
sobra na yung 50
Suction.
kung yung laboy lang talaga yung pinuntahan mo.
Okay. All set.
So we use the Mototron because it allows electrons to precisely deliver radiation and limit the spread to non-affected organs.
Exactly. We'll give one large fraction dosage.
Well, don't you need a radiation oncologist?
I'm double boarded. Blood pressure's dropping, Dr.
Oo, kasama nag-transpo, kasama rin po. Chempoan mo din yung ticket na ano. Yung naka-PC pero ang tinatawag, totoo pala yun. Chempoan mo lang din.
I need quiet so I can work.
Mura lang pamasahe sa Vietnam. Chempoan mo din yung grab nga lang ako ng grab nga lang ako ng grab.
Vascular clamp.
Tingkano lang din. Alis pareho ng presyo sa Pinas.
Seryoso.
Hindi pala yung maano ko. Mura lang pamasahe.
On fluids, wide open. We're good.
Wala na ako.
Change the music, something upbeat.
Big pala yun.
Alright, we're on.
So, it was a question of anatomy. Hers was atypical. Though it didn't show up on imaging, the common hepatic artery was not in its normal position. A less experienced surgeon wouldn't have known to look at that. They would have tied it off like a bleeder, not realizing they're cutting off the entire blood supply to the liver. Because I've seen it before, I routinely look for it, and that habitual extra precaution, and that just tells me what a deadly complication. And now, I believe she's letting him to go on.
Well, I'm certainly happy we had you today, Dr. Bell. I hear you went to my clinic.
I did. I was impressed. Beautiful architecture, inspiring.
You're very dedicated. A real gem.
Tumor margins clean, clear notes.
Isip ko rin doon, sabi ko magasas magbakasyon. Pero, iba pala bossing pag nandun ka. Parang di mo isipin yung gasas, isipin mo na lang muna yun. Nagkakaedad na rin kasi guys.
No.
Totoo yung pinapost ko na ayaw ko mag-antay na senior kami bago kami maglaro.
I'm serious. It took me years to pay off my student loans. Now, we're the best at what we do. We save lives. You deserve to be paid for it.
Senior kami bago. Mahirap puro ipon ng ipon.
I'm serious. It took me years.
Great to see you back.
Good to be seen, Dr. Hawkins. Don't know what you said to convince them to rehire some old ER nurse, but thanks. I owe you a beer.
Oh, it's the other way around. This place is a wreck without you.
Heard today was a rough one. It's a good thing you were here to take over. Which reminds me, janitor turned this in. He found it on the floor. Might belong to your John Doe. Heard today was a rough one. It's a good thing you were here to take over. Which reminds me,
Thank you.
janitor turned this in. Found it on the floor. Might belong to your
Diba? Ang pera nandyan lang din naman na yung higit na lang din natin. Pero tutusin kaya talaga yung Vietnam kahit sino, boss.
This is Dr. Conrad Hawkins at Chastain Park
Maging matalino lang
Memorial.
doon sa pipiliin pamasahe. Huwag magbili ng
I have
magbili
some
ng mga
bad news.
pasalubong.
Your son was
Kaya
in
kaya.
the ER today after an accident.
Naging matao kami sa pagkain kaya lumobo ka ng lumobo. Usapan namin nun.
I don't know. Kitty Hawk.
Yung pagkain, isang order lang gagawin namin para matikman lang. Hindi.
Alright. Wherever you want to go.
Natakam ako eh. Usapan namin. Tingin-tingin ka lang sa Cebu Pacific o kay AirAsia. Machempoan mo yung mga piso fare doon. Yung mga ticket minsan 6,000 balikan na yun. Walang visa sa Vietnam. Kaya pwedeng maglabas-pasok.
I'm going to find a story.
Kaya nga, ang dami nangyari sa yung ano. Mga passport lang. Sinanapan ng working permit kasi first travel niya. Hinapan siya ng COE sa kanila. ID. Ako kasi OFW, marami na akong kaya hindi na ako plan.
Checking to see if there's any greener grass. I heard it sucks. I like working for HUD.
Passport lang, nung pumunta rin kami ng Malaysia, passport lang din, walang visa-visa. Pero yung nakaka-addict magbiyahe. Babalik nga kami ulit na ngayong taon. Ngayong bakasyon. Kailangan makapunta ako sa office ng Skynews.
The chemo dosages she uses are really high.
I'm not a doctor, but I know she puts a lot of thought into coming up with a protocol for each patient. Everyone is unique.
That's terrific.
If you do decide you want to work for Dr. Hunter, one thing I can tell you is she likes everyone who works for her to be discreet.
Maybe that's why it was so difficult to get a patient file from your office.
Oh.
I just remembered that my
Buti na lang,
sitter
madalang,
has to leave early tonight.
COE si Mrs. kundi
Maybe another time.
Pornada pa kami. Inisip kasi ng mga inisip kasi ng immigration dyan sa atin. May TNT dun.
I just remembered that my sitter has to leave early tonight. Maybe another time.
Previously on The Resident.
Medical error is the third leading cause of death.
But you still show up here.
Because it's personal to me.
Lily, you gonna be all right? Possible.
You, Nick. That's still a thing?
I think she's worth fighting for.
Game on.
My approach to this complex procedure will die with me if it isn't passed on to the next generation. What about benzodiazepines?
Last resort, try them, but the side effects are...
Aggression and cognitive impairment.
I guess it just depends how desperate the guy is.
This complex procedure will die with me if it isn't passed on to the next generation. What about benzodiazepines?
Last resort, try them, but the side effects are...
Tapos tayo.
I guess it just depends how desperate the guy is.
Hindi mo kailangan naman ako gusto kung talagang gusto mo.
As I said, it was my responsibility. It was my decision.
I understand, but what was the
Uy, sabon.
cause, Dr. Okafor?
I broke protocol.
Uy, sabon.
Things happen.
Gandang hapon.
This is a
Makapalo ka pa sa
mortality
YouTube
and
ko. Ba't
morbidity
nakikita mo
conference,
mag-live ako?
Dr. Okafor, to ensure that an event like this, a horrific and preventable medical error, doesn't happen again. The surgeries on these three patients took place concurrently, correct?
Concurrent surgeries are not against
Meron
hospital
masyado malakas
policy. The
yung
critical
background.
portions were staggered so the attending could be present.
Nawawala kasi yung music minsan.
Dr. Bell, could you explain how this catastrophe occurred?
Ay, hindi. Nanonood kasi ako ng
Dr. Bell, you were the architect of these concurrent surgeries, so I'll ask again, how did this error happen?
I woke her up at
Nanonood
3
ako
a.m.
ng
to tell her that I'm 85%.
Resident.
And then, yeah, then refused to make an appointment for 6 weeks. Kind of backwards, right, Doc?
I hope the pain would go away.
The number of people who walk in here thinking they have cancer versus the number of people who actually do.
Not cancer.
Thank God.
Bike accident did more damage than you thought. You have an atrophied testicle.
Well, that doesn't sound good. Will it just heal by itself?
With this degree of atrophy and your continued pain, the recommended treatment is removal.
May walang VIP.
Chopping my ball off?
Request mo na ako.
Oh, come on. Come on, guys.
Are you serious?
Calm down. I'm sure there are options.
Okay na ako.
Will we still be able to have kids? Absolutely. You only need one healthy kid.
Salamat sa pagdaan, Boss Lawrence.
Great
Boss Muppet.
news. No more pain and lots of kids. Eventually.
What not? What does that even look like?
Ganda lang po sa na ano, i-access. Boss Muppet. 6.7. Malapit na ulit
Maybe less
$7.
But it doesn't have to be. Dr. Pravesh will show you some excellent prosthetic options. You'll be as good as new in no time. Right, Doctor? Absolutely.
Gonna get your bright, shiny new ball.
It'll be super fast. Really?
Then I'll come after work.
Well,
you know you won't, please. When I get fired from my job, who pays the rent? You? You, Dr. Feldman? Just let him make sure you're okay. That's all. Trevor, pretending to be sick to get me here was the last thing I needed today. Now I'm already pissed. Don't push it. Christine, how the hell do you know my name? You, Dr. Feldman? Why? Who is this lady?
Only the best nurse in this hospital.
Dr. Feldman asked me to come down. And drag me to a hospital room?
Bakit may bago
Christine,
ka
who's
ako?
gonna pay the bills if you have a stroke?
Ba't ka nagpuputol ng puno?
What the hell did you just say to me? Or a heart attack. You smoke, right? Probably spend a lot of time on your feet. Who do you think you are? Look, Dr. Feldman is worried about you, which means that I am worried about you. I was around his age when my mother...
Nakakuha ka ba ng ano? Lunas Landing?
I'll get you the best doctors, I promise.
Plano ko mag-shop pag nag-400. $408 ano? Nag-hold ako ron for January 3rd. Anong meron sa January 3rd? Birthday. Happy birthday.
Hey guys!
Hey, York.
I'm back.
Paige Conrad.
Yep.
Hindi wala akong ano, VIP.
What I'm saying is our ORs are rarely at capacity. Save Orthopedics, led by Dr. Simic, which has been practicing concurrent surgeries with incredible results. I would like all departments to do the same.
That would mean splitting focus, welcoming chaos. I find multiple surgeries irresponsible.
I've never had a problem, and we do them all the time.
You haven't had a single error or complication?
Relax. We're not reinventing the wheel. It goes on the
30
hospital
ba yung
all
ano
around the
nun?
country. It's an excellent training ground for residents. The practice is perfectly legal, and if it's well planned, the surgeries can be as safe as any other. Relax.
Dr. Bell, is there a reason
30
you
pa main
stopped
price ng Fortune Rolling.
If I'm not mistaken, it's been over a year.
Next month.
I've billed over $35 million in the last 14 months.
February ka pala kaya ko lang.
Just set the bar unusually high. I would like everyone to rise to the bar, if not exceed it.
Sayang hindi ko inabot sila call ka saka sila. Yung alis ko ng Pinas, dating nila ng Pinas. Hindi ko tuloy na-meet yung dalawa.
Do me a favor, get excited, Pravesh. One of my favorite patients just landed, and it's a case that will inspire you, it will touch you, and make you believe again. York! Hey! My man!
Out na ako. Salamat na Boss Lawrence, Boss Muppet.
Oh, sorry. That's okay. Honest mistake.
See my review? My mom cried like a baby when she read it.
Guys, it's the least that I can do after your astute medical care.
Salamat na Boss
Oh, who do we have here? A fresh new intern.
Dr. Pravesh.
Welcome to Chastain, Dr. Pravesh. You are fortunate to be working with this medical mastermind.
Yes, I am.